The flu vaccine has been made out to be something that it really isn't. There's been misconceptions created over time that say that it actually injects the virus into our bodies, which is a misconception that has been put out to the public for many different reasons and has caused people to almost be afraid of the vaccine when it was created to help our bodies, not harm it. People need to be educated about this vaccine so that people can stop fearing it and allow it to be helpful to their bodies, like its original purpose. So the first inactivated flu vaccine was developed by Thomas Francis and Jonas Salk at the University of Michigan. The vaccine was tested for safety on the U.S. military, and then it was later passed and licensed for wider use in 1945. At the time, researchers suspected that there were different strands because different blood types weren't responding to this vaccine that they had created. So they later found the new strain of the virus called influenza B. And we all know there's an influenza A and an influenza B. So in 1942, a new vaccine was developed that protected against both the H1N1 strand of influenza A and the newly discovered influenza B virus. During the 1947 flu season, researchers discovered that existing vaccines were still ineffective against the flu viruses circulating at the time. To investigate that virus in circulation, the World Health Organization established the Worldwide Influenza Center in 1948, and then in 1952 they established the Global Influenza Surveillance and Response System. These two establishments would help scientists now manufacture vaccines based on the monitoring of virus strains in circulation around the world, updating the strains targeted by the vaccine in response. So researchers and scientists had finally found a way to keep up with all the different strains of the flu, because there are so many that now there's different vaccines for each one. So when people get sick with the flu after getting the vaccine, it just means they might have gotten a different strain of the flu, unfortunately, because there's so many. Now that we know about the history of the vaccine, let's look at some studies that prove this point furthermore. Here's a study done by the CDC that says the flu vaccination can keep you from getting sick with the flu. The flu vaccine prevents millions of illnesses and flu-related doctor's visits each year. For an example, a 2019 to 2020 study showed that the last flu season prior to the COVID-19 pandemic, the flu vaccination prevented an estimated 7 million influenza illnesses, 3 million influenza-associated medical visits, and 100,000 influenza-associated hospitalizations, and even 7,000 influenza-associated deaths. People that got the flu vaccine, their risk were reduced by 40 to 60% of having to go to the doctor with flu-like symptoms. Another CDC study shows in 2021 that adults hospitalized with the flu vaccine patients had a 26% lower risk of intensive care unit and a 31% lower risk of death from the flu compared with those who were unvaccinated. So do your own research for the flu vaccine and see all of the helpful things it has instead of finding all of the misconceptions of the harmful things that it can do to our bodies. If people do not educate themselves on the true purpose of the flu vaccine, they will continue to put themselves at risk of contracting the virus harder and putting their health at risk to decline. While the flu virus is common and does not have a high hospitalization or mortality rate, when people refuse to get this vaccine, they're only putting themselves at risk to be that small percentage of people that are affected greatly. So overall, people have allowed misinformation with the flu vaccine to cloud their judgment on a vaccine that was created to help our bodies fight off a virus that has many different effects, some being minor and some being much more serious, and can lead to hospitalization or death if not treated well. So despite some myths and misconceptions about the flu vaccine, it is not harmful to our bodies and its benefits far outweigh its possible negatives, according to studies done by immunologists and epidemiologists. So happy researching, and don't forget to get vaccinated.